This is a quick video about the auscultation of heart valves. Auscultation is the act of listening for sounds from inside the body, and in medicine, it's normally done with a stethoscope. We can use bony landmarks to work our way to certain spots on the thorax that are optimal for listening to the sounds from particular valves. We start with the jugular notch, work our way down from there to the sternal angle, and then to either side of that, we find rib 2 and its costal cartilage. From there, we're going to make our way to particular spots to listen for sounds from particular valves. Starting with the sternal angle and moving over to the second rib on the right, dropping down into the second intercostal space, this is the auscultation point for the aortic valve. Skipping over to the left intercostal space, again underneath the second rib, we find the auscultation point for the pulmonic valve. Dropping down to either the fourth or fifth intercostal space on the left side of the sternum, depending on who you talk to, this would be the auscultation point for the tricuspid valve. And then swinging out into the fifth intercostal space where it intersects with the left midclavicular line, that's the auscultation point for the mitral valve. It's important to note that these auscultation points don't represent surface projections of the anatomic positions of the valves. Far from it. These are the spots on the anterior chest wall where we can place a stethoscope and expect to hear loudest the noise made by a particular valve. When the valves shut, they make a rumbling sound, and given the orientation of a particular valve, it tends to project that sound in a particular direction to a particular spot on the chest wall. Those are the spots that we're choosing when we try to auscultate the individual valves. I want to finish with a handy mnemonic for remembering these auscultation points. From patients right to left, top to bottom, we have A, P, T, M, and you can remember all patients take medicine or all physicians take money, whatever suits you.